You've been in office 3.5 years. You don't have a plan.
Well, we haven't had, excuse me, you heard me yesterday. We're signing a health care plan within 2 weeks, a full and complete health care plan. But they'll get it under control. In our current phase, we must focus on protecting those at highest risk while allowing younger and healthier Americans to resume work and school with careful precautions. Ideally, we want to open those schools. We want to open them. At the same time, we're placing an emphasis on continuing to drive down the mortality rate with improved care, treatment, and medical interventions, building a bridge to the introduction of a vaccine. The vaccines are coming along incredibly well. Today, I'd like to also provide an update on the actions of my administration and the work that we've done. We're really taking an increased interest, and we're seeing numbers that nobody can even believe in terms of percentage increase. It's telehealth for American patients. The percentage increase is being worked on right now, but it's very, very significant, numbers that you would not even think possible. This has been a priority from the beginning of my administration when we launched an initiative to allow veterans to connect remotely with their VA healthcare team, and it worked out really well. We have a 91% approval rating in the VA in terms of the job we're doing. This is the first, it's the highest ever recorded. Now telehealth is a critical part of our path forward in the VA, and it's becoming a critical path, especially with our senior citizens. You don't have to go to the doctor's office. You don't have to go to hospitals. When the invisible enemy struck our shores, I took immediate action to eliminate regulatory barriers to telehealth, making it easier for patients to consult with doctors from safety and convenience. And really, they have great safety and great convenience right from their homes. Today, I'm taking action to ensure telehealth is here to stay. Moments ago in the Oval Office, I signed an executive order to make many of our regulatory reforms permanent. We've done some regulatory reforms that have had a tremendous impact on what we're doing, on medicine and medical and what we're doing. They can do things that you wouldn't believe, that even a year ago, 2 years ago, would not have been doable. We're enshrining the right of American patients to meet with their medical providers in a way that is best for them and very, very convenient, and very talented people on the other side of the line, I have to tell you. The order builds upon a series of actions we've all taken to make telehealth available to all. We ensured that Medicare covers telehealth visits at no additional cost. That's no additional cost. And co-payments can be waived for telehealth services. We are working very hard also on prescription drug prices, and I will tell you that the favored nations clause that I've signed into existence, nobody thought anybody would ever do that, has a massive impact on prescription drug prices, in addition to the 3 other elements of reduction of drugs, particular prescription drugs. But the favored nations clause is massive. For instance, and they're all doing it, they're doing it gladly. Prior to the epidemic or the pandemic, whatever you want to say and how you want to refer to it, but prior to the pandemic, the telehealth was fine, but it wasn't anything raging. And I guess one of the only good things that we've gotten out of this whole horrible situation is telehealth has been incredible. And again, the increases are, many hundreds of times greater than it was before. Do you have a number? It's like 2,000% or something like that. It's an incredible increase. You'll get the number, but I think they have it now finally, and it's really an incredible. Thank you, Kayleigh. We work with the leaders of major health insurance companies to ensure coverage for the telehealth visits related to coronavirus. We cut red tape to allow many services to be conducted by phone rather than video, which is much simpler, providing a much easier option for many seniors in particular. 35% of the Medicare beneficiaries who receive telehealth services, or over 3.6 million seniors did so over the phone. So you're talking about 3.6 million seniors. That's something. 10.1 million Medicare beneficiaries have accessed care through telehealth since the beginning of the pandemic. So you're talking there, 10.1 million people. In April, over 43% of all Medicare primary care visits were done via telehealth, and compared to less than 0.1% in February. Those are part of the numbers that I think I'll have you get them. So this part you don't have to. You'll get the other section. Thank you. So think of that, compared to less than 0.1%. 0.1%. That's an incredible number. So over 43% of all Medicare primary care visits were done via telehealth compared to, so you went from 0.1% to 43%. That's an incredible, it's an incredible number. The executive order I signed today will also expand healthcare access in rural America. We take care of rural America. It directs agencies to deploy strategic investments in our rural communications infrastructure. And we're working very hard with all of the people in government that are involved with the communications infrastructure so that the telehealth gets very quick and easy access. Additionally,